Okay. Would anybody like
Good afternoon, everybody. We have a front row that's wide open in case you want to sit there.
They're good seats.
My name is Ted Burton. I'm Director of Communications here at Central Health. First of all, I want to welcome you to Central Health. Thanks for being here. We appreciate your time. We are doing 2 Meet the CEO finalists for Central Health, and tonight is our first meeting. Mike Geeslin joins us tonight. Thank you, Mike, for joining us. Mike is one of 2 finalists under consideration by the Board of Managers for this CEO position here. The other finalist is Valetta, Abdellatif, and she will be here on Thursday night at 4:30, and you're welcome to come back to that meeting as well. First, let me explain how today's meeting is going to operate. For the next 45 minutes, I'll be asking questions that were submitted in advance by Friday at noon, plus questions that were prepared by B.E. Smith, the recruitment firm that has been leading the effort with our Board of Managers to select the next leader of Central Health. So it'll be a combination of both of those questions. We have about 45 minutes for this Q&A session. Then you're invited to stick around for another 45 minutes to meet Mike one-on-one. So if there are any questions that come up in your mind during this meeting that we don't ask, I would ask you to please hold those questions, and then you have a chance to talk to Mike one-on-one when this portion is completed. To be fair to both candidates, we're going to ask the same questions tonight and the same questions this Thursday. With that, we'll get started. And Mike, we can sit or stand, whatever's most comfortable for you. So let's begin.
Sure.
First, would you introduce yourself to our community members here? And tell us a little bit about yourself.
First of all, welcome, and thank you all for coming out. This has been a great process, and I'm glad that this is part of it so that we can have a conversation, and I look forward to the meet and greet afterwards. But my name is Mike Geeslin. I live here in Austin, Texas. First arrived here in 1993. Lived in Wimberley for a brief period of time, but moved back in 2000, and we live in South Austin, my wife and 3 kids, and myself. Kids have been through public schools, and so Austin's been a big part of our community life for quite some time. My background started out in public policy. I worked for a couple of legislators, survived that, and then went to work in the executive branch of government, and ultimately wound up at the Department of Insurance, where I was deputy, and then later served as insurance commissioner from 2005 to 2011. After that, I did some consulting. Most of my consulting was around the Affordable Care Act. And then after that, I went to work for the Texas Dental Association, where I am now currently serving as executive director. So I've seen both the government side of things, but also the nonprofit side of things. And both management opportunities have just been phenomenal, but also very different. And have worked in very large organizations in excess of 1,400 personnel, but also smaller organizations under 50. So I think, just in terms of what brings us all here, public service is a tremendous opportunity. And if you look at what is happening here, just in terms of the transformation, but also what we're doing to not just bring care to the uninsured or the low income, but changing the way it's done, to me, is just a fabulous opportunity. So this is what brings me here today, and I'm thankful to be part of this process.
So Mike, can you describe an experience where you've been accountable to a public-funded organization and, of course, taxpayers?
Yes. So when I was at the Department of Insurance, we had a budget that was a little over $100 million. Now, it wasn't that much, actually. It started out a little over $50 million, but then they folded in another state agency. And so we doubled in size. We went from around 700 some odd to over 1,400 personnel, and to a budget of about $100 million. And twice a year, you go down to the legislature and you ask for money. And you can't just go in and ask for the money. You have to tell them what you did in the prior 2 years with those funds, especially the current fiscal year. So being held accountable, publicly accountable for funds is not strange to me, but also making sure that your processes and procedures are in place, because when you're audited, you want clean audits. You want people to come in to be able to turn around to, be it the decision makers, but also the public, the person that walks out to her driveway on Saturday and picks up the paper and wants to know what's going on in this community. You want that person to be satisfied that everything's above board and in accordance with policy. So that's a bit about my experience. I could go into great detail, but I know talking about public budgets on an afternoon may not be everybody's favorite topic, but I'm happy to go into as much as you want me to.
So how did you provide transparency regarding the organization's activities?
Right. Well, I think first it's important you have to realize that you've got, for example, let's take a state agency. You're dealing with the legislature. But then also you have the public. And it's one thing to put something, to get a website up. I mean, anybody can do that. But the question is, what's the content on that website, and is it meaningful? But also, just in terms of talking to the media, you want to make sure that, yes, you're answering their questions, but at the same time, you're providing enough background so that when people are reading the stories, they get the context to it all in terms of what you're doing. And I think that, you could get into open records requests, but I think that there's just some level of information that you don't wait for the open records request, you get it out there because it's important to people. They need to see what you're doing with their funds, how you're serving the people you're supposed to be serving, or what it is that you're thinking for 5, 10 years down the road from there.
I want to talk about partnerships. Can you describe the organizations with which you have partnered, including academic partnerships? What were the benefits of the partnerships, and what were some of the challenges?
Sure, benefits and challenges. I'll point to one that we did with the University of Houston downtown. And what they started was an insurance program, it was a bachelor's degree program. But what we were hoping to do was bring something to the downtown Houston area, because that's in large part a commuter school. But you had people that were working jobs. It wasn't a traditional matriculation from high school into college, but people that had been out in the workforce for a while were paying for their own education, but we wanted to see about getting them a degree. And this is an advisory committee that I served on after I'd left the insurance department. But in part of this advisory committee was to work with the director of this department in making sure that this program was capturing everything that it needed to capture, that these students needed when they graduated, that they could be successful in whatever jobs that they had. The second goal was to improve upon the diversity, because the problem in the insurance industry that it was not diverse as it should have been. Some companies really did a good job at trying to improve diversity within their ranks, but by and large we felt like, okay, this may be one drop in the bucket, but we're going to make it meaningful and make it count. But that was another goal of this program. There have been other instances where I've worked with my alma mater, A&M, in the communications department and communications workshops, and that's just direct one-on-one working with the students and the faculty members. That's something that I did while I was in office at TDI, and something that I miss, quite frankly, because I think when you're on a college campus and you're connecting with the next generation of, you never know if you're talking to the next CEO or an astronaut or whomever, but to be working with those students and helping them figure out what in the world am I going to do with a liberal arts degree is fulfilling on some level. So those are two of the examples where I've worked in higher education. As far as public partnerships in general, one of the things that I try to do, not only in my current job with the association, but also when I worked for the state, is really engage stakeholders. And before you get to the point of inking the deal on what the money's going to look like, who's going to pay for what, you have to figure out what's the outcome here that we're trying to achieve. And one of the things that I pride myself on is being able to sit down with groups of stakeholders and say, what is it that we want to achieve ultimately? Because otherwise, you have to figure out, okay, well, what is it we're really asking the money for?
So Travis County taxpayers approved a $35 million annual investment in Dell Medical School back in 2012. Right. For this investment, what community benefits do you expect, and what type of reporting mechanisms would you insist on?
So $35 million, that's spelled out in the agreement with the Dell Medical School. That's an important investment. And the way I look at it is that you've got some tangibles that you're going to be able to see in terms of the doctors that are going to be out in clinics treating people and transforming the way healthcare is delivered. But I also think that in terms of holding that partnership accountable, because a partnership's just like any type of business arrangement. You've got situations where, one partner may be larger than the other, financially, organizationally. One partner may be more sophisticated than the other. But at the end of the day, it has to work for everybody involved in this thing. And I think as with any business partnership, you have to understand what your strengths and what your weaknesses are, what their strengths and weaknesses are, And you have to constantly be putting that on the table. I mean, there are partnerships where that doesn't happen and they go horribly awry because somebody's not able to shoulder their load. But I also think that on the vein of holding people accountable, that it's spelled out not only in the strategic plan under the measures that Central Health has adopted, but it's also spelled out in that partnership agreement with the Dell Medical School that there will be certain tangibles. And I think it's incumbent upon whoever gets this job to make sure that, you know, the executive team, but also the enterprise partners, as well as the board of managers, are engaged with the medical school in making sure that we understand when the deliverables will come about. In other words, when's the milestone? When are we going to hit that? But then second, what are the actual tangibles that are going to come about as a result of this? And tangibles, the way I look at it is you start with a doctor-patient relationship and you got to ask the question, are you feeling this? And maybe that you're not. And if you're not, then you got to circle back around and figure out how do we make the true tangible values obvious to the doctors and the patients that are out there, because those are the two end users in the health relationship.
Okay, I'm going to move on to your financial experience. Can you describe the size and scope of the largest budgets you've managed, and do you know what percentage of those budgets were public funded?
So the largest budget I've managed was a little over $100 million, as I stated earlier, and that was with the Department of Insurance. And forgive me for not knowing what percentage of the total overall state budget that was, but I could certainly follow up with you on that. Now, in addition to that, we also had, at any given time, several $100 million held under trust. And it fluctuated. And what I mean by that is that if you had an insurance company that was in trouble and we were worried that we needed to be able to have the money because we needed to be able to make the policyholders whole, then what we would do is we would ask for, obviously, deposits, and so we had to hold those funds in trust. Now that was, I want to be clear, that was not on budget, meaning we could not spend that money, but those were monies that we had to hold because they were there for a specific purpose, and that was to make sure that ultimately the policyholders were made whole and that the financial solvency of that company was good. So I wanted to clarify, because that's a big number, but you know, some of it was part of the budget, but some of it wasn't.
So what metrics are most important for you, and what did you use to follow, for you to follow to allow for financial stability and future growth? What are the metrics that you use or you believe are important?
Well, in general, I think that when you're providing services to people, and let's just take healthcare and more importantly, transformative care that's been contemplated in these partnerships that we have in this community. I think there's all kinds of data that's out there that shows what the health outcomes are, and they're measured on a population level. And I think it's important to begin and end with that data. But I also think that I want to go back to what I was saying earlier about the doctor-patient relationship, that there's something to be said for the qualitative side of things. I mean, we're all inundated with data right now. You can get on a website and within minutes, you know, have more digits and figures in front of you than you really know what to do with. But I also think there's the human element to it, where if you can get to that, let's call it patient satisfaction, or that provider satisfaction in trying to serve their patients and pull that data in, I think that's important. Now, that is difficult to do. I'm not here to say it's just, yeah, you can just flip a switch and do surveys. It is not easy to do at all. But I do think that on a periodic basis, it's certainly a worthwhile exercise, because again, if we're doing these things up here at this big macro level, but then it gets down to, you know what, it's not working for the doctors and the patients, then like I say, we got to come back to the drawing board. So that's another important metric that I think that I would fold into this. Now, having said that, a lot of this, obviously, it has to be approved by the Board of Managers in terms of what we do. And whenever you go to the County Commissioner's Court for approval of the budget, then there's that piece of it as well. But I think generally speaking, you know, we need to pull in those qualitative data sets. In my past life, past jobs, we focused on, I'll give you one specific example. We would field several hundred phone calls a week on our consumer assistance line. And it was simple questions about where do I shop for homeowners insurance or auto insurance or renter's insurance? How do I get health insurance? We set up a new health insurance program called helpinsure.com. To, we need help because we're having problems with an insurance company getting the claim paid. And we would track those incoming calls. We knew what kind of calls we were getting, and we knew the success rate in answering those calls within a certain period of time, as well as our capture rates on the phone, but then we also knew what benefit were we returning to the consumer to the extent that they had a complaint. Because what we wanted to see was, one, what's our efficacy in terms of serving the people that are calling in, asking for help, and are we getting to them quick enough? And to the extent that they got to have a complaint that needs restitution, how fast are we getting the restitution back to them or the claim paid? And so those were immensely valuable metrics in terms of tracking, are we truly helping the people we're supposed to be helping? There were other tons of metrics that I could go into, but I don't want to crowd over the other questions.
Okay, we're going to move on to service. Can you tell us of a time when you had to develop and implement a plan to ensure that service provided by your organization was being delivered in an efficient and equitable manner?
Well, let me go back to what I was just talking about. If, when you look at assisting consumers that are calling in with questions or complaints about people that are not necessarily providing the service, the insurance carriers that weren't living up to their side of the agreement, we had systems in place to make certain that we were conversant in multiple languages. And if we weren't, then we had translation services where we could quickly get to. But to make sure that we didn't want language to be a barrier to getting the help that you needed, because insurance was complicated enough as it is. And I think making sure that you can accommodate people, not in the language they speak, but in a manner that is culturally relevant is absolutely important, so that they feel that they can trust you, because you often don't have the benefit of getting to know people in a way that's meaningful over the telephone and or in a very limited experience. And so we wanted people to trust us. And coming up with call scripts, if you will, to make sure that people understood that this was a place for them to come to get assistance, not necessarily be interrogated to the nth degree about what was going on with this particular issue, and giving people the benefit of the doubt too. So those are principles that we employed and made sure that they were delivered consistently. It didn't matter who you were calling in. We wanted to make sure that those are the services that you received. Now, I will point to one other example. Whenever the hurricanes hit Texas, and this would have been Ike, Dolly, and Rita, and then we also helped Katrina evacuees that came over from Louisiana. We went out to the disaster recovery centers to provide assistance, and a lot of times it wasn't even just insurance-related assistance. People would come in and want to know, I need help figuring out how to get my electric bill put on hold because I'm not working right now, and I get paid by the hour, and I don't make a salary, and I don't have the means to be able to pay this. And so we would find a way to help them with these problems. And honestly, I got to give the staff the credit. They just made it up out there in the field. But that's okay that it wasn't insurance. We were going to help them anyway. So personally, I would go to the disaster recovery centers, and then if traffic was a little bit slow, what I did is I would go out into neighborhoods, and I intentionally didn't go to the neighborhoods that I felt like were probably getting attention. I went to the places that they weren't. One example that I can give you is this would have been after Hurricane Dolly in the areas around Rio Hondo, and if those of you that have from that area or have been there, you understand the colonias and the situation that presents. Absolutely one of the most deplorable situations that you could be in, but I made it a point to get out there, and sometimes people, they don't want to talk about insurance issues. They're just trying to figure out how do we get ice and water and just the basic necessities to get through the unbearing heat. But that's something that, I made it a point because I knew other areas that don't have these means, they're going to be taken care of. And it's not that I was trying to belittle their situation. I mean, they lost things too. But there were other people in other areas of the state that, they needed help more so than anybody else.
So how do you ensure that customers, clients, patients are treated with respect and consideration without regard to their economic status?
Right. I think in the healthcare world today, people need space to be able to make a decision, and they need to be able to maintain their dignity. And it's difficult enough as it is because hi, come on in. It's difficult enough as it is, with getting to the doctor, sitting in a waiting room, and, figuring out, what's going to happen to me. And so to the extent that we can really focus on, again, go back to the doctor-patient relationship, what that experience is going to be like, regardless of who you are, where you come from, what the method of payment is. It doesn't matter what program you're coming through. The experience ought to be the same, equally and across the board. And saying, allow people to maintain their dignity, that means different things to different people, but I think that's just something that you're never, ever really done with trying to perfect. It's just one of those things you just keep front and center at all times.
I want to ask you about women's health. How would you plan to increase Central Health's funding support for providing family planning and women's health services to include all approved methods of birth control and emergency contraception?
Yes. Well, right now, you don't need me to tell you this, that the funding environment is hostile. It just goes without saying. But I think that you have to continue to figure out, what are your second, third, and fourth generation of funding sources for women's health, for the full spectrum of reproductive services. But then you also have to figure out the provider piece as well. And I think that's where engaging with the community as well as the enterprise partners comes in hand. It comes as really important, because you have to figure out what's going to be workable, and then you have to go secure those sources of funding. Now, to sit here and say, I've got this plan and it's right here, and unfold it and hand it to you, that I don't have. But I think that's part of this process. Again, is engaging the community as well as the enterprise partners to figure out, okay, we know where we are today in terms of funding for reproductive services and for women's health. But what else do we see out there, even if it's not a government funding source, that we can go look at, and making sure that the provider community is going to be able to deliver what women ultimately need or want, and then making sure that matches up.
So what do you bring in your experience and leadership style that will help Central Health navigate the potential changes in funding of healthcare?
So we're all watching the Affordable Care Act right now. And of course, the legislature's in town, but you know as much as probably any of us do. You can pick up the paper and figure that out real quick about, okay, what isn't happening in Washington, D.C. But I think once the dust starts to settle on that, especially, we were talking about Medicaid block grants earlier in the day. I think we'll start to see what the funding sources are going to be looking like. But again, out of the necessity to try to mitigate your operations, that they're not interrupted, and that it's seamless for the patient population, I think, again, you have to be looking not just at the Affordable Care Act and what the legislature may or may not be doing with Medicaid funding, but again, start to look at those second, third generation of funding sources. And right now, if I could wave a wand and make the answer appear right here, I would certainly do that. But I think we're all in the same boat in that we're beholden to these legislative bodies in terms of the decisions that they're making.
So as an advocate for the underserved or the safety net population, describe how you've made an improved difference in your community and what you're most proud of.
Again, I'm going to go back to the department, and I want to talk about something that I've currently worked on. But whenever health insurance companies would come in and they would ask for approval to sell a particular form, there were certain mandated benefits that were directly related to women's health, not only on certain reproductive services, but on cancer screenings, on mammograms, on non-discrimination on pregnancy issues, that those things either had to be in the form or conversely they were prohibited from being in the form. And so the goal was to make sure that whatever ultimately was approved had all of those mandates or didn't have any of the prohibitions in them. But then that was just so that that form could get out there. But then a lot of times we would get complaints about the carrier's not covering this, or they're saying that the meaning is completely different from the way that I'm reading it. But that's when you try to resolve the complaint. If you can't get it resolved, then you take it to enforcement. Now that's just one example given us at the Department of Insurance. Something that I've done here on a more local level, and unfortunately I've only participated in 2 of these events just for scheduling reasons, but being able to participate in charity dental events has been just a phenomenal experience for me. And I'll be honest, I'm actually a runner at these events. That's what I do, because I'm not obviously a dentist. But what I do is I'll work with a small group of dentists and making sure that the flow in their areas is working like it should. And in the course of that, and this is important when you talk about community relations, but in the course of that, people will start telling you their stories. and they start talking about why it is that they would like to have this dental care. And it's not necessarily to relieve pain, it's to get their smile back. Maybe they're on the rebound, they're trying to get a job. And so things that are important to them, and you can have some really meaningful conversations with individuals that are just willing to bare their soul. And fortunately, I've been able to do these 2 events. I wish that I had done more, but those are 2 really eye-opening episodes for me in terms of the way people value healthcare, because we would automatically think, well, people are there maybe to deal with a toothache. No, it's completely different. It might have to do with their self-esteem or their, their standing in their family or at their employer. What you value may be completely different from what the other person values. And I think that that speaks to what is critical to community relations. When you talk about dealing with somebody else that is not you, that doesn't look like you, that doesn't have your background, sometimes you have to forget about who you are. You have to ditch your experiences. You have to forget about the town you grew up in, whether or not you went to college, whether or not you graduated from high school, and you have to become that person for a moment. Because it's one thing to listen to what people are saying, but it's quite another to actually hear them. And that's what you have to do. And I think that these experiences in terms of, that I've kind of outlined, that's one thing that I've learned over life, is that in order to truly relate to people, you have to forget about who you are and try to become them, even just for a moment, so you can understand where it is that they're coming from. So thank you for letting me answer the question you didn't ask me, but I appreciate it.
So why does this position, which requires the strongest possible advocate for people who are low income or lack insurance, why does this position appeal to you?
One, it's a public service position, and it's here in the community. And when I served on the Sendero board, this was back late 11, maybe 2012 through 2014, I was able to see into the window of Central Health. And I'd kind of known about Central Health, but then it wasn't until I was on the Sendero board that I really got a much better glimpse into what was going on. And it just blew my mind, because we've been kind of tilting at the idea of 1115 waivers and what to do with them. And you talk about value-based care. About this time, the Teisberg and the Porter paper had come out. That is, obviously we have one such person now at the Dell Medical School, but these were just concepts that were starting to take root. But then now they're real. I mean, you can see it. You can drive down the road. You can go over here to the Southeast Medical facility, which, by the way, I understand that had a lot of community input, and those of you that were involved in it, what a great facility. Good job. You should be proud of what you all helped come up with. That's just phenomenal. But I think that the realness of it is what appeals to me, and the fact that you have people that, for no fault of their own, they didn't create this economy that we live in. They didn't invent the stock market. They didn't invent Federal Reserve Board and all these things that drive what we do. But through no fault of their own, in situations that we have the resources and we have a very strong community backing to be able to do something about this. And I can look at it from an economic perspective, but I prefer to look at it from a humanitarian perspective. It's the right thing to do.
So in the past, how have you reached diverse populations and communities to create an ongoing dialogue to ensure their concerns are not just heard, but also addressed? And do you have any examples of that?
Yes, and well, I gave you some examples in terms of being at the disaster recovery centers and talking one-on-one with people, but also setting up systems to where we could accommodate people in a way that was linguistically and culturally relevant. But I would say my MO is, I think there are formal groups, and you could say it's the LULAC Council, it could be local chapter NAACP, it could be the Latino Healthcare Forum, but then there are all those informal groups that you have, and it could be a neighborhood thought leader, somebody that doesn't have a fancy title next to their name that's part of one of these groups, but somebody that collectively, if you said, who could I have a conversation with about this, that at least half a dozen people are going to point to and say, you really need to go visit with this person. And what I like to do is, I call it the edge of the driveway conversations. I don't have a front porch, so we sit out the edge of our driveway, but I like to have those edge of the driveway conversations where you can sit down and, yes, in order to be held accountable, you have to tell people, right, look, this is what we're working on right now. But then at some point you have to be quiet and you have to listen. And again, listen so that they're actually being heard, not just listen to their words, but hear the meaning of what they're saying to you. And I just prefer that one-on-one approach. And granted, we work in, with big data sets and, with big agreements and all this. And, when I was with the state, it was a very complex organization, and we were dealing with some very complex financial and economic matters. But it always came back to, again, you got to roll up your sleeves and just go have some one-on-one conversations with established groups, but also with thought leaders that maybe are not part of a formal group, because it keeps you grounded. It reminds you, these are the people that we're serving. It reminds you that what you think might be important is absolutely not important. Something else is infinitely more important. And I just think this is part of the human experience to sit down and have a conversation.
So can you describe a specific success that you've had meeting the needs of diverse citizens in this community?
Yes. I'm going to point to the work on Sendero, because that was something where, we had just had this certificate of authority approved for the health plan, and we had to figure out, and again, I want to give kudos to the management there, and as well as some of the program staff that were working on this. I was on the board, so the credit needs to go where it needs to go. But our responsibility was to make sure that we were launching this health plan in a way that was consistent with the central health mission, which means that we had to serve the uninsured community to the extent that we could get them insured, or if they were part of the Medicaid STAR or the CHIP program, that we could get them signed up. And I think it was about, it took a while to get up and running, and I think that part of that was due to the delays that the state had in terms of getting it approved. But once we were up and running, we were able to start reaching out to those diverse groups, not only just linguistically, but again in a way that was culturally relevant. And I know that a lot of time was spent, even at the board level, going over some of the outward-facing or the outbound program and promotional materials to see, okay, is this going to hit the mark? Is this going to be relevant? And to me, that was a huge success in terms of very quickly launching that. There are some individual successes that I could talk about, working at disaster recovery centers, where you had somebody that, in fact, I think this was in Houston after Ike. This woman came in and she had a stack full of papers, and it was about as thick as that backpack right there. And she came in, she sat it down, and she said, "I don't know what I'm supposed to do." And I said, "Well, let's figure this out. What's the issue here? Is there an auto claim or home claim or whatever?" And we were able to sort through all of this, but you have to be able to work with people that, they're busy. I mean, they probably had to take off work to come, sit at our little table and try to sort this out. But you have to be mindful of the fact that, they don't have a whole lot of time, and they need quick answers, and really they need you to do things for them. Because to get on the phone and talk to an adjuster or to talk to somebody in an insurance company to expedite this payment or whatever, that's something I really enjoyed doing. Like I say, it was one-on-one help. It wasn't anything at a big macro level, but it was one of the more fulfilling things that I've ever done.
So do you have any final thoughts for the community as we wrap up this portion tonight?
Sure.
Anything you'd like to share?
Well, one, I want to say what an honor it is to be considered, and the things that Central Health is doing here in connection with all the community partners and the medical school it's just unheard of. And I really do think, you talk about a model community that is in fact being built here as we speak. I also think to be able to serve the community in a way that, up to this point in my professional career, I've outlined a few instances and I've outlined a few programs, but this is certainly a way to give back going forward in a way that this is really a unique opportunity, and it's not lost on me what the mission is and who it is that we're supposed to be helping day in and day out. And regardless of what the decision is, know that I'm always going to be a big fan of Central Health, and know that I'll always take an invitation to come sit at the edge of your driveway and hear what's on your mind. So I really appreciate this time. I know we kind of got a meet and greet coming up, and I look forward to having some more conversations, but really it's an honor to be considered for this, regardless of what the outcome is. And I thank you all for your patience.
Thank you, Mike. Thank each of you. Thank each of you for being here tonight. We know your time is extremely valuable. Sharing an evening with us, I think the mics have just gone off, is really important, and we're glad you could be here. As Mike mentioned, and as I said at the beginning, now we're going to turn the mics off, and Mike will be here for the next 45 minutes or so. So I invite you to grab something to drink, something to eat, and talk to Mike. If you had any questions that we didn't address during this session, you're free to talk to him now. So thank you guys for being here.